Lupus is an autoimmune disease, and that is when the body's immune system attacks organs and tissues of its own body. The inflammation caused by lupus can affect many body systems, and since lupus mimics signs and symptoms of other ailments, it can be difficult to diagnose. People who have lupus are born with a tendency toward developing lupus. Lupus can result from genetic and environmental causes. Although in most cases of lupus the cause is unknown, there are things in the environment that can trigger lupus in people with predispositions for it. Predisposing factors for lupus include a person's sex, age, and race. Although lupus can affect anyone, it is most common in women in ages between 15 and 45. It is also more common in Hispanics, Asian Americans, and African Americans. Things that can trigger lupus include sunlight. When exposed to sunlight, skin lesions or an internal response may be triggered in susceptible people. Infections can initiate lupus in susceptible people or trigger a relapse. There are also medications that can trigger lupus, including antibiotics, blood pressure medications, and anti-seizure medications. Lupus can be drug-induced, and in this case, lupus will get better when the medication is stopped. Lupus is an autoimmune disease, and again, that is when the body's immune system attacks its own organs and tissues. Each case of lupus is different, and this combined with the fact that the signs and symptoms mimic other diseases makes it difficult to diagnose. Lupus causes inflammation that can affect many different body systems, and because of this, the signs and symptoms will depend on which systems are affected. Common signs and symptoms include fatigue, shortness of breath, chest pain, fever, and dry eyes. More symptoms include headaches, confusion, memory loss, and skin lesions that appear or worsen with sun exposure. People may also experience their fingers and toes turning blue or white during cold or stressful situations. Rashes, joint pain, swelling, and stiffness. The most distinctive sign of lupus is the butterfly rash, which is a rash that is the shape of a butterfly on one's cheeks and the bridge of the nose. Because of the many symptoms of lupus, it can be difficult to diagnose. It is common to mistake lupus for other diseases based on the symptoms. Although there is not one single test to determine if someone has lupus, there are other ways. These include noting a family history of lupus or any other autoimmune disease, or noting one's own medical history and keeping track of symptoms. Blood and urine test can use the anti-nuclear antibody test to show if one's immune system is more likely to make the antibodies of lupus. It is common for people with lupus to have a positive anti-nuclear antibody test. Although just having a positive anti-nuclear antibody test does not mean someone has lupus, and their doctor should order more antibody tests. Having a complete physical exam can help to diagnose lupus. This is because this is when the doctor will look for rashes and other signs. Having a skin or kidney biopsy can help diagnose lupus as well. This is a minor surgery in which a sample of tissue is removed, and then this tissue is looked at under a microscope. When the tissue is looked at in this way, signs of an autoimmune disease can be seen. Any or all of these could be used by doctors when diagnosing lupus. Lupus does not have a known cure at this time, and this means that treatments are used to improve symptoms and help one to feel better. The overall goals of the treatments are to treat symptoms, prevent flare-ups, and reduce organ damage and other problems. The goal of using medicines as treatments includes reducing swelling and pain, reducing or preventing organ damage, reducing and preventing joint damage, and calming the immune system to prevent it from attacking tissues and organs. Some of the medicines used include corticosteroids, which can calm the immune system in high doses. These also help to reduce tenderness, pain, and swelling. Non-steroidal anti-inflammatory drugs are over-the-counter and can help reduce swelling in joints and muscles and mild pain. Medicines that treat or prevent malaria are anti-malarial drugs, and these can also treat fatigue, joint pain, and lung inflammation, and skin rashes. In severe cases of lupus, immunosuppressive agents or chemotherapy may be used. These lower the body's ability to fight off infections, which can be a serious side effect. Specific inhibitors and limit the amount of abnormal B cells that are present in people with lupus. Follow-up care for lupus includes appointments and self-care. It is important to stay healthy when dealing with lupus. This includes reducing stress, reducing tiredness, and taking care of the skin, and general self-care. Some things that could be done to reduce stress includes keeping a simple schedule, regular exercise, and meditation. To reduce tiredness, it is important to get enough sleep each night, and some people end up needing 12 hours of sleep each night when they have lupus. Some ways to take care of one's skin include avoiding sunlight, but if someone with lupus needs to be in the sun, they should cover up or use sunscreen with a high SPF. There are also corticosteroid creams that can be used for symptoms related to the skin. General self-care can involve taking prescribed medicines, avoiding people who are sick, not smoking, brushing and flossing your teeth, and eating a healthy, balanced diet. Lupus cannot be prevented, however, triggers can be avoided to prevent flare-ups. To avoid flare-ups, it is important to know what can trigger them, like not getting enough rest and overworking. Injuries, infections, and stress are also common triggers. When someone with lupus is out in the sunlight or exposed to halogen or fluorescent lights, a flare-up could be caused. Medicines can also cause flare-ups, whether it's taking a type of medicine or stopping lupus medicine.